is such a need for sexual assault nurse examiners, because in North Carolina, there's not a state mandate that a nurse performing those exams has to be trained. So it could be a nurse, just a regular registered nurse in the emergency department that's completing this sexual assault evidence collection that has never done so before. So having that specialized training makes it, it's better evidence collection. It's more effective. It's better for the state crime labs. It's more useful in court. Our prosecutors prefer that they are SANEs, and then they also have the opportunity to testify as expert witnesses. So once they have that training that we provide, they testify as expert witnesses. They have had 40 clinical hours of training, and so they've done at least 5 or 6 exams, so it's more cohesive. I've always had the mentality that if you build the program, they will come. So our New Hanover Regional Medical Center used to see maybe 60 sexual assaults a year. Now we're averaging about 250. So once we had SANEs in those facilities and people knew that they could go there, have evidence collected, and that they had a trained professional that was doing those exams for them, they started to come. So it's not that sexual violence isn't happening, it's that people don't know that those options exist for them. And so the whole purpose of this grant was to make sure that these hospitals were equipped to handle that, but also that they educated the communities that that's what they were supposed to do when they were assaulted, was come to the emergency department, have evidence collected so that it could be processed and file a report to law enforcement. Besides training, a lot of them didn't have the equipment that they needed. So I met with facilities that said, I don't even have a camera, or I'm not using Toluidine dye, which is what they use to highlight any injury that may be present. They didn't have any of the equipment that was necessary to have a competent exam. And so what we did through the grant was purchase them cameras, maybe examination tables. They didn't have a bed with stirrups. They didn't have the basics that would make the exam comfortable for the patient and that would make it to where they could have excellent documentation. So if you don't have a camera, you can't document bruising, you can't document any tearing, you can't document, petechiae, whatever may be present from that assault. You need to be able to show it on a picture so that whenever the case goes to court 2-3 years later, which is our reality, that picture is there for the jury. Just education in general, it's been shocking to me how, because it's not necessary or mandatory that any of these facilities educate their nurses on what SANE exams are. And so going into these facilities and educating managers and CNOs and really high up medical personnel about this process and getting a response that's, oh, we didn't have an idea that this was even an issue, or we had no idea that this is how things went. It was just a total lack of awareness. And so just a little bit of education went a long way, and they realized that they weren't doing things the way that they should be, and that we needed to be giving them the materials that they needed, and they needed to actually be having trained nurses doing these exams. I was kind of shocked at the lack of equipment that they had, and once we purchased them that equipment, they were able to do the exams in a competent way, and they felt more confident in their abilities.